Just over 3 months ago, Russell's primary care provider diagnosed them with hypertension. They attempted to make some lifestyle changes, including exercising at least 30 minutes a day, following the DASH diet, and reducing their daily salt intake. Although Russell's made some great lifestyle changes, their primary care provider recommended they consider medication to help reduce their blood pressure. What are some of the medication options? When would medication treatments be considered for someone with high blood pressure?
Generally, medications are considered when someone has been diagnosed with any stage of hypertension. Definitely, if your blood pressure is greater than 140 on 90, we recommend treatment. But there's been more evidence to suggest that if you can get your blood pressure under 120 on 80, then you will derive additional benefit. So the first step is just making sure you've had an accurate measurement, eliminating any lifestyle problems that you've identified and we've addressed previously, or changing behavior if possible. And then if those have failed, then you can consider treatment. The other reason you'd put somebody on medications for blood pressure right away is if their blood pressure was just too high. And so you don't think that those lifestyle changes are going to result in a benefit, or it's dangerous that their blood pressure is going to be significantly elevated. So, if their blood pressure is consistently 160 on 90 or 160 on 100, then you definitely want to start somebody on some medications if you've gone through those other, if you have an accurate measurement of your blood pressure.
So, after someone's made attempts to alter their lifestyle choices, consulted with their healthcare provider, and let's say a medication to manage high blood pressure has been being considered, what are some of the medications that are most commonly used to treat high blood pressure?
There are several different classes of medications that can be used to treat blood pressure, and they act on different physiologic targets within the body. So some blood pressure medications can work on the smooth muscles in the arteries and relax them so that the blood pressure is lessened. And then some blood pressure medications will decrease the blood volume. So they increase the amount of fluid that you pee out on a daily basis.
That's a great description of the different targets for these different medicines. Would you walk through maybe some of these different classes a little bit, just in case people want to hear a bit about the names and how some of the drugs might work?
Absolutely. There are 5 main classes that are commonly used of medications to treat hypertension. There's big overlap between this first 2 groups, which are angiotensin II receptor blockers, otherwise referred to as ARBs, and angiotensin converting enzyme inhibitors, referred to as ACE inhibitors. They both act by inhibiting the production of angiotensin II, and also downstream to that, chemical called aldosterone, which is secreted by your adrenal glands. The impact of these medications are that they will relax the blood vessels so that the pressure diminishes, and also they can help decrease the reabsorption of sodium in the kidneys. The second major class is beta blockers. So beta blockers will prevent the sympathetic nervous system, which is responsible for increasing your heart rate and constricting the blood vessels. So it can block that from happening so that the blood vessels relax and thereby decrease your blood pressure. Diuretics, common medications that you might hear would be hydrochlorothiazide or chlorthalidone or spironolactone, work by increasing your kidneys' excretion of sodium from the kidneys and into the urine, and decreasing your blood volume. And by decreasing your blood volume, your blood pressure can be decreased. And the final is calcium channel blockers or antagonists, which work against the smooth muscle in your blood vessels, which will also dilate those blood vessels and decrease your blood pressure. Your doctor may choose a combination of these drugs or pick one drug in particular because of the medical conditions you have, and they may provide additional benefits for those specific medical conditions. So ACE inhibitors or angiotensin receptor blockers are good if you have chronic kidney disease. Beta blockers might be good if you've had a recent heart attack or if you have heart failure. And diuretics might be good if you have a secondary cause of high blood pressure and you have elevated aldosterone levels, and spironolactone might be used. And calcium channel blockers might be good if you have angina. So there's a whole host of reasons, and there'll be a complex decision-making process that your doctor can take you through. And also sometimes and oftentimes, one blood pressure medication is not enough to control hypertension. And so you'll be on several of these medications. And in fact, there are even pills where you'll only have to take one pill, but it will have several of these medications in that one pill. And that would be a combination pill. So it saves you from taking additional medications, but you're targeting different physiologic pathways within the body.
So if I take a medication to reduce blood pressure, or the medication's prescribed or a combination, will that medication be required for the rest of my life?
I would say that most frequently that is the case. And even in people that have normal blood pressure while on treatment, we still consider them as having hypertension. Situations where this may improve is if you have a secondary cause of hypertension. Let's say you had a hormone secreting tumor and that was removed, or if you required a lot of blood pressure medications, but you did all of the lifestyle changes. You lost a ton of weight, you're exercising quite significantly, you decreased your alcohol consumption. There are cases where those lifestyle interventions can decrease your blood pressure to a sufficient degree. As we've talked about in different lessons, it is the silent killer though. So if you're going to stop taking your blood pressure medications, don't just do it on a whim. Be measuring your blood pressure on a regular basis to make sure that, if you stop your medications, you can follow it and see whether your blood pressure is persistently elevated off your medications, and always talk to your physician before making any drastic decisions about your medications.
I think, as you described, there's so many different classes of medications. It's important to talk to your doctor about side effects that may be troubling you, because there are alternatives or combinations that might be able to address any adverse effects that you're having from a particular medication.
Absolutely. It's also important to discuss with your doctor and your pharmacist, to read the pamphlets that they give you. For instance, you can have a sick day protocol if you're on a diuretic, which decreases your blood volume. So if you're very sick and you had nausea and vomiting or diarrhea, and you're losing a lot of blood volume, you may want to hold taking that diuretic and go and get some blood work taken, depending on the types of medical conditions that you have. And then always following for the side effects. So beta blockers, for instance, can make people feel very tired and fatigued. They can cause erectile dysfunction and cause depression in some people. So you definitely want to make sure you're not causing those symptoms. And you may be able to tolerate different combinations of medications. So it's very important to follow your symptoms closely with your physician.
I guess, it's important conceptually. The high blood pressure or hypertension is probably best thought of as a chronic condition. It's not likely to be cured. It might be something, though, that can be well managed with the combination of lifestyle and medication interventions. But it is something that you'll need to continue to manage, most likely throughout your life. So if someone is being treated with medication for high blood pressure, how low should their blood pressure be with that treatment?
The decision to treat high blood pressure and the target for treatment should always involve a discussion between the patient and care provider based on the patient's values and the best scientific evidence out there. Generally, people will target less than 140 on 90 for treatment for people that have a diagnosis of hypertension, and that's stage 2. However, there is some evidence to suggest that controlling blood pressure and getting it lower, even under 120 on 80, can provide some additional benefits. So if people tolerate the additional treatment and they're interested in trying to pursue those additional benefits, and they're not having side effects from the medications, then you might want to target a lower blood pressure than 140 on 90. The other things to consider as well is orthostatic hypotension. So having your blood pressure fall as you stand increases in prevalence as people age. And so that needs to be monitored for so that people aren't falling down or getting dizzy when they're standing up. And oftentimes people that have diabetes or Parkinson's disease can also have this problem. So it will depend a little bit on what the patient is interested in and whether they're interested in taking medications. It will depend on their underlying medical conditions. And it will depend on whether they really want to, pursue those additional benefits that may take place. For the patients that have orthostatic hypotension or the drop in blood pressure when they stand up, you may need to target a higher baseline blood pressure so that they have room to fall. And so that's another consideration as well when coming up with a reasonable blood pressure target.
Great. I want to thank our guest today has been Dr. Richard Sztramko with a great overview of blood pressure. Those with high blood pressure are first encouraged to make lifestyle changes to try to reduce their blood pressure. Some of the changes that might be recommended in order to lower your blood pressure include quitting smoking, decreasing alcohol, trying to exercise 30 to 60 minutes per day most days of the week, and to follow a balanced diet, such as the DASH diet. In some cases, these changes are not enough, though, and medications will be needed to help combat high blood pressure.